Before you join a health share, it's important to know what your responsibility is as a health share member, because health shares work differently than traditional healthcare options. But don't worry, it's actually pretty simple once you understand it. So in this video, I'll walk you through everything you need to know as a health share member so you can avoid mistakes and make the most of your health share membership. So let's get into it. First up, your monthly share. This is your member contribution. This is the money you send in each month to your health share so that medical expenses can be shared among members. Think of it like a community pool. Everyone contributes, and when someone has a medical need, the community helps. And just like any membership, whether it's a gym, Netflix, or your phone bill, you've got to pay on time. Most health shares have a grace period, but if you miss payments, you could lose eligibility for sharing when you need it. So just set it and auto pay is your friend. So here's something to note. Most health shares do not share in the small medical bills. That means things like regular doctor visits, prescriptions, urgent care trips. You'll usually handle these smaller medical expenses on your own. Now, some health shares do include certain wellness visits or preventative care, so just check your member guidelines and check the details. Some health shares will also offer discounts on prescriptions or free telemedicine, so that's good to be aware of. Okay, let's talk about the bigger medical expenses. With the health share, there's something called the member responsibility amount or the initial unshareable amount. Depending on your health share, it's going to be called different things, but this is what you pay before the health share steps in to share the rest of the eligible medical expenses. So for example, let's say your initial unshareable amount is $1,000 and you have a $15,000 surgery. You pay the first $1,000 towards your medical expenses and your health share steps in for the rest. So before anything gets shared, you need to know your initial unshareable amount and be prepared to pay for it. All right, now let's talk about submitting bills. This is really important. Unlike traditional healthcare where a doctor's office submits all the paperwork for you, with a health share, it's your job to send in the right paperwork. Here's what you usually need: an itemized bill from your provider, so not just a statement that says what you owe money, but the itemized bill, and then a proof of payment such as a receipt if you've already paid anything towards those medical costs. It's also important to note that there's usually a deadline. Most health shares require you to submit your paperwork to them within 3 to 6 months, plus or minus. Now, if you wait too long, your medical expenses might not be eligible for sharing, so be sure to understand and know how long you have to submit those medical bills to your health share. One of the best things about health shares is that you're in control of where you go for medical care. You're not locked into a network, you can shop around for the best price, and you just can ask for a cash pay discount. Many providers offer up to a 50% off to patients just paying directly to them. So some health shares will help you even negotiate bills for you, so just check with yours to see if they offer that service. If they want you to do the negotiating, usually you just need to ask for a cash pay or self-pay discount, and they'll be happy to give that to you. Last but not least, make sure you understand your health share's member guidelines. Every health share has different rules about what's eligible for sharing, so here are a few things to look out for. Pre-existing conditions. All health shares will have a waiting period, so it's important to understand them and know them. All of them will have lifestyle requirements, such as avoiding tobacco or excessive alcohol or drugs, and maintaining healthy habits. Some of them will have religious lifestyle requirements that they want you to keep to. So it's important to know those. When it comes to preventative care, some share in it and some don't. So whenever you have a medical need, double check with your guidelines so there are no surprises. All right, let's do a quick recap. So here's what you are responsible for as a health share member. So 1, your monthly share, pay on time to stay active. 2, smaller medical bills. These are usually your responsibility unless your health share includes wellness visits and preventative care. 3, your member responsibility amount or initial unshareable amount, basically what you pay before sharing kicks in for the larger medical bills. Submitting itemized bills and receipts on time with proof of payment. and in some cases, negotiating medical costs. Again, ask for self-pay discounts, or your health share might do this for you and you don't need to worry about that. And of course, understand and follow the member guidelines. Make sure your medical need is shareable. Health shares can save thousands of dollars on your medical costs, but only if you understand how they work and what's expected of you. If you want to learn more about health shares, make sure to subscribe and check out my free guide, the Health Share Guide and Essential Checklist. It's got everything you need to know before joining a health share, and you can find the link right below this video. Thanks for watching, and I'll see you in the next one. Thanks, guys.